I am here tonight. I want you to introduce yourself and tell us a little bit about what you do, and then I've got a slew of questions to ask about the world of dentistry.
Yes, there is a world. I'm Dr. Chris, Dr. Christian Hahn. I'm a biological cosmetic dentist. I lived the normal dental life for quite some time. And then I woke up. I was known as the cosmetic dentist in the world for a long time. I did a TLC episode, Extreme Smile Makeover. I was teaching cosmetic dentistry all over the world. And something was missing. And I just felt like this is missing the mark. And yes, cosmetics is important, but the world was getting sicker. And the more I dove into the holistic side, the more I decided that it's all about biologic dentistry, functional dentistry, whole body dentistry. And I completely switched to treating the entire body through biologic dentistry, maybe 10 some odd years ago. And now I practice here in Bozeman, Montana. The lifestyle of a biologic dentist is that just as important as what we do for our patients. So I chose to live in an environment that represents the health and wellness that we discuss. And I'm here to answer any questions you may have about your health and how it relates to your mouth. And we believe it starts in the mouth. So let's get started with that.
Absolutely. Okay, so I have a bunch of questions. So first one, anytime you go to a regular dentist every year, they're
Mhm.
going to take a bunch of x-rays.
Yeah.
Are those necessary or are
Mhm.
those toxic and should be avoided?
So, very interesting question. X-rays is a hot topic because in the old days, X-rays were the evil, right? We used to wear this big lead vests and we'd hide behind the walls as we take the X-rays on our patients. It's that's safe, Don't
Right.
mind the lead apron. Don't mind us stepping out of the room. Um, is it necessary for a diagnostic tool? X-rays are absolutely essential. So when you first see a dentist,
Mhm.
any dentist, they need to have the information to give you a thorough exam. That doesn't just include regular x-rays, that includes a 3D scan, a cone beam, whatever you want to call it. So we cannot give you a thorough analysis of your mouth if we don't have information. Now, that is initially. Do you need x-rays every 6 months? Absolutely not. Do you need cleanings every 6 months? Absolutely not. It is different for every person. So yes, it's way overdone. It's of course the insurance driven. Every 6 months, they're going to pay for it. And that's dentistry fell into that loop. So x-rays are essential, but not all the time.
Okay, and then part of the cleaning, we'll get into that. Of course, they're going to lather
Mhm.
you with this fluoride film
Mm,
right
fluoride.
after your cleaning. So I've opted out of that and have my kids opted out of
Mhm.
that. What's your take on this fluoride film
Mhm.
that they put on your teeth after cleaning?
You see, here's the deal, Sarah. It's it's more complicated than that. It's about complete informed consent. You have to understand the good and the bad. And until now, every dentist just did a fluoride varnish or a fluoride rinse or fluoride toothpaste or fluoride fillings. Fluoride is everywhere. And that's what we were taught in dental school. We used to make these trays and fill them with foam on kids and put them in their mouth. It was essential. There's no, is it good or bad? It is something you have to do. Now,
Mhm.
we know better because if you look at both sides of the coin, you realize that there is a tremendous amount of information out there on fluoride being a neurotoxin,
Mhm.
fluoride lowering the IQ in children,
Yeah.
fluoride doing all kinds of things. So, that being said, the EU, 17 countries, did a review of studies and published it last year, and it said fluoride has no safe level. Meaning we don't know if it's 1 drop or a gallon. It's just not safe. So they actually took it out of their water supply. We took it out of the water supply in many states already. There is a myriad of studies out there that tell you fluoride is not safe for children especially. And still, dentists, the ADA, they just don't understand that if there's a question about safety, maybe we should err on the side of caution. We have other things that do what fluoride does. We have
Mhm.
hydroxyapatite, which is a whole nother hot subject. You don't want the nano version, but we have ways to remineralize your teeth. In all honesty, if you are an unhealthy person and your pH in your body is wrong, You can stuff somebody full of fluoride and it won't work. You see, it's a systemic problem. The mouth is not separate from the body. We cannot just treat the teeth without realizing why in the first place are you getting decay. Fluoride is not the answer. Fluoride is a cover with very negative side effects that parents should be aware of.
What's your favorite toothpaste? And a lot of them will say ADA recommended, and then it will say if you swallow more than the recommended amount to brush your teeth, call poison control, right? So it says it right there on the
Oh,
toothpaste.
yeah.
What is your go-to
Mhm.
toothpaste that you use for your family, your kids,
Mhm.
your patients?
Absolutely. Excellent question. People ask me all the time, what toothpaste do I recommend? And I have a unique answer, which I'll give you in just a second. But think about this. If it has a poison control warning on it, and you're putting in your mouth, you're supposed to brush your kids' teeth as soon as they show up, right? You have like a 1-year-old that has a bunch of teeth already. That child is not supposed to swallow the pea-sized amount of toothpaste that has fluoride in it. Has a parent ever called Poison Control Center because their child swallowed toothpaste? No. They put the warning on there to cover themselves because they know it's bad for you. And if you get too much of it through the toothpaste, the water, the fluoride varnishes, the fillings, there's fluoride everywhere. In sodas, everything is full of fluoride. You're going to have an issue, right? So if a toothpaste has fluoride in it, it's a big no for me. It's a hard no. But there's other things in there that are just as bad. You should be able to eat your toothpaste. Very simple. You're going to eat your toothpaste. It's going to go in your mouth. You're going to swallow it. There's no way. It's not the ingestion of the toothpaste that's the problem to begin with. It gets absorbed in the membranes. It gets absorbed in your gingiva, your tissue. That's what tissue does. It absorbs immediately. That's why nitroglycerin tablets go underneath the tongue. It's absorbed like that. So you're going to absorb it, right? Toothpaste-wise, I feel that we never know what our body really likes, and every single human being is different. So I rotate everything in life. I rotate my toothpaste. I will go through one tube of something, and I'll tell you what I'm using currently, and then the next tube is going to be different. And I usually have about 2 or 3 go-tos, and I rotate them so that my body can recuperate from maybe something that is in that toothpaste that I'm unaware of. I'm a huge fan of Dr. Rosen's toothpaste right now. So he is a good biodentist from Dubai. You can't get it in the United States yet.
Of course.
Of course not. But it is it's a toothpaste you could eat. It's all natural. I'm also okay. I rotate through a doTERRA essential oil toothpaste with no hydroxyapatite. And there is a controversy with Boca. I don't use them anymore because when I had a conversation with them, they couldn't be clear on if it's nano hydroxyapatite or microhydroxyapatite. Nano is too small. Nanoparticles go everywhere in your body, between the cells. I feel it's dangerous. There's only one specific particle size by one specific company in the world that's allowed to make it. That is too specific, okay? And even then, we don't know anything about nano really. So if it advertises nanohydroxyapatite, it's a hard no for me. I'm okay with micro. Micro's a lot bigger. It has the potential of remineralizing teeth. So there's many decent organic micro toothpaste out there. Risewell is micro, as far as I know at this point. I also rotate through Super Teeth. Super Teeth is micro. Their new whitening is nano. Don't use that one. So I use Super Teeth, I use Rosen, I use Risewell, and doTERRA at this point. And eventually I just want to make my own because
you should. I would buy it because it's so confusing. I usually will get the Hello toothpaste, the charcoal.
That's fine.
But I guess I haven't. My go-to is looking for fluoride. So if it says fluoride free, but I don't really look at the other ingredients so much because I'm just set on that fluoride. So good to know.
Hey, you don't even need toothpaste. Toothpaste is the least important part of your oral hygiene routine. You should actually brush just with water to start. Otherwise, you're going to feel like you brushed already and you're going to not do such a good job. So you should brush with water anyway.
What about baking soda? Just baking soda on the...
Fine. Baking soda is fine. It's not, people think abrasive. You can clean your pots with it. They don't scratch. Your teeth are glass. It doesn't scratch. It's pretty safe to use a baking soda toothpaste.
Okay. What about gargling with hydrogen peroxide?
So hydrogen peroxide. Let me ask you first why you think you would need to gargle with hydrogen peroxide.
I don't, but I have a stepmother who is
Hmm.
a retired dental hygienist. Of course, it's the indoctrination of the ADA stuff, but that was a big thing that she would have the kids do is gargle with
Hmm.
hydrogen peroxide. So
Hmm.
I've talked to people, they said I felt like the cavity was coming on. I
Hmm.
gargled with hydrogen peroxide and that whatever those symptoms were went away. And so I don't know. I don't do it, but I've had a lot of people ask me if that's something that they ought to
Yeah,
do. I don't have that
it's
answer.
a good question. That's a really good question, Sarah. Hydrogen peroxide. All right, so the reason you would want to gargle with hydrogen peroxide, and I'm a huge biome fan, as you probably know, the reason you get cavities is because you have bacteria in your mouth that release acid. That acid dissolves the tooth structure, and we call that a cavity. Bacteria cannot eat teeth. That's a misnomer. Cavity bugs, it's ridiculous. They
Yeah.
cannot eat teeth. The more acidic or the more acid that bacteria releases, the
Mhm.
quicker your tooth demineralizes and the more likely you're going to get holes in your teeth,
Mm,
cavities, and those
mhm,
holes represent excellent opportunities for your bacteria to hide in because they don't
mhm,
want to be brushed away or killed by your saliva. They're going to hide in these holes, right? And
right,
so most of us have what's called Streptococcus mutans bacteria in the mouth.
mhm,
That is the one we call the most virulent. When you look at a beautiful brand new baby, it doesn't have any strep mutants. As soon as
mhm,
that first, cuddle from the parents or the grandparents, they just share the most infectious, contagious disease in the world.
mhm.
Cavities, infectious because it's bacteria. It's strep
Yeah,
mutants mostly. These strep mutants are very acidic. And so when you gargle with something that kills bacteria, and that could be ozone water, it could be tea tree oil, it could be hydrogen peroxide, it's going to kill all the bacteria that it touches immediately. Of
yeah,
course, the ones that are hiding in the deep pockets, in the cavities, in the tonsils, etc., they're going to come back. And whoever is most prevalent, the most amount of bacteria, they're going to win, right? So your strep mutants is going to probably high, and they're going to win. They're going to repopulate. But for the time that you killed those bacteria, you're going to reduce your risk for cavities because there's less
sure.
acid.
Yeah.
But hydrogen peroxide has a negative side effect. You shouldn't use it for more than a week at a time. It
Mhm,
creates these really small bubbles. And when you put something underneath the tissue or in a crevice or anywhere near tissue, it's going to explode with an amazing force and it's going to tear apart the tissue,
mhm.
including the mouth.
Yeah.
So, for a temporary solution, part of my process of getting rid of cavities, the first step is to nuke the bacteria in your mouth. I
Sure.
choose ozone water for many reasons, but you can use a 50-50 water and hydrogen peroxide solution to nuke the bacteria as well. And
Okay.
then you're going to have to rebuild it. But yeah, if you
Sure.
have the wrong biome, doesn't matter what you do, you're going to get
Sure.
cavities. You can brush all day long.
Sure. Okay, what's your take on bleaching? So
Mhm.
whitening teeth. What is your go-to? What's safe? What's not safe?
That's also a really good question. Bleaching. Everybody wants white teeth.
Uh,
And I'm not against white teeth. I was a cosmetic dentist. I'm a cosmetic dentist. Accredited cosmetic dentist.
yeah.
White teeth are extremely important for confidence, extremely important for your expression of who you are. And whitening your teeth is not always negative, but
Mhm.
you can overdo anything in life.
Sure.
Whitening is carbon peroxide or hydrogen peroxide. It is something that's going to bleach your teeth.
Mhm.
If you have sensitive teeth, meaning you have an acid imbalance in your mouth or an issue, cavities, very bad idea to use
Mhm.
whitening agents because they're going to exacerbate the problem. That being said, whitening your teeth for an hour a day for a week or two to get those really nice white teeth is not going to hurt your teeth and
Mhm.
it's going to increase your life quality. And I'm all about increasing your life quality, right?
Sure.
So, yeah, I'm not against whitening. I'm against whitening addictions and
Yeah.
whitening at the wrong time.
Yeah. Yeah. Perfect. Okay, another one. I mean, I've seen so many posts about lidocaine. Um,
Mhm.
the heavy metals in the lidocaines, the toxins and lidocaines, and actually some dentists getting magnets, whether this is true or not, to
Mm-hmm.
kind of pull these heavy metals out of the syringe to inject. Is that something that you see, something you do, or is it
I'm
just
one of
all
those guys. Yeah. So
okay?
there is now we're stepping into the conspiracy theory
Sure.
categories, and I live in that. I tell patients, that rabbit hole. I live
Yeah,
on the bottom. Okay, so
yeah,
you let me know when it gets uncomfortable.
yeah, yeah.
La Quinta Columna is a group of researchers in Spain.
Okay.
Amazing, brilliant people, and they study everything, and they release it to those who are interested. You can see the research. Nobody's going to publish their research because it goes mostly against the norm of big pharma, but it's the
Sure,
truth.
sure.
They studied over 3,000 vials of dental anesthetic, lidocaine, articaine, septocaine, everything they could find. And they've done this for carpules that were old as well. Every
Mhm,
single one of them contained graphene oxide.
mhm.
It's my belief that graphene oxide is one of those really terribly negative things that you find everywhere now. And you have to protect yourself against it, and you have to find a way to detox from it. So when
Mhm.
you see a dental syringe, we are dentists, an
Mhm.
incredible vector of anything they want to inject in you. May
Yes.
that be a vaccine or toxins or nanotech or whatever it is.
Mhm.
I don't want to be that person.
Mhm.
So they studied how can you remove the graphene oxide from these dental carpules, as we call them. What they
Mhm.
did is they heated them up to a certain
Okay.
temperature, just warm, not too hot. Then they took a magnet, a round magnet with a hole in it, and they ran it down the anesthetic 3 times.
Uh-huh.
Because when you heat the graphene oxide, it polarizes it, makes it magnetic. And then when
Mhm.
you grab it with the magnet and you drag it down to where the stopper is, you do that 3 times. Then you inject, then you insert your carpule into your syringe, and you run that magnet down the syringe, and it stays at the bottom of that carpule. Then you
Sure.
inject the patient and you leave this much at the end where the magnet is to hold all the graphene oxide. I did a
Mhm.
video of this for all my biologic friends, and
Yeah.
everybody cares. Everybody wants to know about this. And I do this for
Mhm.
all my patients
Mhm.
because if there's a question about safety, we should err towards safety.
Yeah.
It takes me an extra 30 seconds
Mhm.
to do this to protect my patients. I don't want to inject graphene oxide for many reasons. And
Mhm.
so my answer would be, yeah, I think there's a concern. And I think you need to take precautions, and most biologic dentists will be doing this for you.
Sure. Okay. And then all your teeth are connected to different parts of your body, right? So
Mm-hmm.
I've
Meridians.
read,
Mm-hmm.
I've heard, seen, you've got a toothache on one side of your mouth and you've probably got some sort of inflammation, communication pathway, something going on in an organ or somewhere else. Is
Yeah.
that when you look at someone's mouth and you see something going on, can you almost kind of see what is going on inside of their body
Mm-hmm.
just off of an exam of their mouth?
So, absolutely, yeah, there are meridians to teeth. Now,
Mhm.
to most dentists, this is a foreign language.
Yeah.
But if I tell the dentist, or I ask the dentist, or even the patient, have you heard of acupuncture? Oh, yeah,
Mm.
absolutely. Acupuncture. Do you think it works? Yeah, it works. Yeah, it works. I sent my dog to get acupuncture. I get acupuncture. So they understand energy flow. Acupuncture is the exact same thing as meridians. When you insert a needle in a certain part of the body, you're releasing a blockage of energy. In other words, there is a circuit. And if the circuit is broken somewhere, that circuit then won't flow, and that causes issues. Your teeth are that much more important than even acupuncture because they're right next to your brain.
Mhm.
The largest cranial nerve goes right to the teeth. So you are intimately connected to every part of the brain and through a circuit to different parts of the body. So until you've experienced it, even acupuncture seems hocus pocus. Let me give you a personal example. I had lower back pain. as
Mhm.
long as I can remember, probably since my middle 20s.
Mm.
When I graduated from dental school, I'm not perfect. I had a cavity and I ended up getting a root canal. Okay, right
Ah,
here.
we'll talk about that.
Yeah,
Yeah.
it's disappointing, but we'll talk about that.
Yeah.
I went to the best specialist because I knew all the people, and he did a fantastic whatever root canal. And
Mhm.
I was also a gymnast most of my life in college, and I had all kinds of injuries,
Mhm.
ride horses, injuries, whatever. And so then after many years of dentistry, I had major lower back pain, like all dentists have, right?
Sure,
Lower
right.
back pain, upper back pain, neck pain. You know,
Abs
chiropractors and us, we're like this. We all trade with a chiropractor. I mean, we used to.
Yeah.
So then I saw a biologic dentist, a friend of mine, and I chose to take out the root canal, and we'll talk about that in great detail. The
Mhm.
day after the root canal came out, lower back pain was gone. Not
Wow.
just less, but completely disappeared. And it's on the meridian or the relationship to that specific tooth. Now, until you've experienced it, it was almost unreal to me because I've had lower back pain for so long, and I did not personally relate it to a tooth. I
Mhm.
related it to my occupation,
Right.
dentistry, and
Right.
I spent a lot of time with osteopaths, with chiropractors.
Mhm.
It was the tooth. So
Inter
yes,
Yeah.
many
Yeah.
illnesses and ailments are linked, and there's a chart, there's a meridian chart. You can look it up and you can see what ailment you may have in the body and how it could possibly be related to your tooth. We
Mhm.
don't guarantee anything, there's no guarantees in life,
Sure.
but
Yeah.
from experience so far, the vast majority of people see dramatic improvement in the meridian that is blocked by fixing it.
Okay. Tell me a little bit. So I had reached out to you. I have 2 root canals. Of
Mm-hmm.
course, at the time that you get them, you're in so much pain that you don't you for me at least, I'm like, I really don't care. Just take away this pain. I don't care. I'm sitting in your chair until you can see me. Nothing else. There's no pain medication that can take away the pain of a
Mm-hmm.
toothache. And so I did the quickest thing,
Absolutely.
and I know it's not the most holistic or healthy for me. So there's
Mm-hmm.
times where I'm like, is that tooth kind of bothering me? And I know I need to get it removed. So tell me about the experience of having that done,
Mm-hmm.
the
Absolutely.
process of it.
Root canals. That is the most controversial subject in dentistry, as you probably know.
Yeah.
Endodontists spent a tremendous amount of money to discredit the root cause documentary. They even got it removed from Netflix. That's how important it was to
Interesting.
them. Okay.
Yeah. Okay.
So there is a definite need for root canals. Let's start with that. A root canal is an art. I did my share of root canals until I decided that it wasn't the best option for patients. But I did my share, and as good of a dentist as I am, there's a lot of root canals that I did that I think a endodontist or a root canal specialist would have done a lot better. And we'll talk about the details of how this works. But when you're in acute pain, there
Yeah.
is only one thing you can do, and
Yeah.
that's a root canal. The pain is so tremendous. There's 3 pain nuclei in your brain attached to every single tooth.
Wow.
Every other injury or experience has 1. So there is no comparison to tooth pain. When
Right.
you're in tooth pain, you need to get out of pain. And the only thing you can do is a root canal. A quality endodontically treated root canal by a specialist is probably the least harm you could do, because now you
Mhm.
have a dead organ in your body, but it is as well treated as possible. So that being said, there's a lot about root canals that I think patients need to know.
Mm.
No other medical specialty allows a dead organ to stay in the mouth or in the body for very long.
Right.
A tooth is an organ, it's alive. It has
Mhm.
a lymph system, it has
Mhm.
a nerve system, autonomic nerve system. It has both parasympathetic and sympathetic nerve system. It has a blood supply. It
Mhm.
feels, it reacts. It has many more purposes than just pain. Okay, it's not just a unnecessary nerve that when you take the nerve out, now there's no more pain and it functions the same way. That's not how it works. There's a living organism inside your tooth. That living organism is millions of little tiny tubules. They're called dentinal tubules filled with live cells. If you lined all those cells up, all those little tiny tubules up, the smallest tooth in front has 3 to 5 miles of tubes in it.
Wow.
Okay? They're all filled with living material. When they clean your root canal out to take the pain away, they only clean out the main nerve, and they try to wash it with all kinds of liquids, including bleach, to try to kill out, as many of those tubules as you can, but they're never, ever going to get even a fraction of those tubules cleaned out. So what happens? All those tissues die and rot, okay? It's a perfect breeding ground for anaerobic or oxygen-hating bacteria, the nasty ones, the really bad ones. They then live around your tooth inside those tubules, and they slowly multiply. And when they multiply, they release metabolites, toxins. Those metabolites travel out of those tubules into the periodontal ligament, the part around your tooth. The periodontal ligament holds your tooth in the socket. Your body sees these toxins and these bacteria come into the ligament, and it says, oh, this is bad. We have to kill these guys. So they create inflammation, constant chronic inflammation. They can't get inside the tooth because there's no blood supply. There's only your immune system lives in the blood. And if there's no blood supply, it has a place to hide. So you got like billions of bacteria and all kinds of other things inside that tooth that can never be removed, that you can never kill with the immune system. And it's a chronic inflammation. I believe chronic inflammation is the root cause, no pun intended, of most diseases. And so that gets worse and worse and worse with time. If you have a great immune system, you have a little bit of time. If the root canal was done really well and the main nerve is taken out and you just didn't want to lose your tooth, you fell on your front tooth and you don't want to lose your front tooth right away, I get that. If a child bumps their front tooth and they obviously can't have that tooth removed and replaced right away because they're growing, a really well done root canal is a good temporary solution for an acute problem. Okay. So yeah, I'm not against that. And I think if more dentists can do excellent immediate root canals, that's way better. But most root canals I see are done poorly. And it's immediately full of bacteria. Immediately there's an abscess on the bottom. And immediately your body's fighting this, a losing battle. And chronic inflammation destroys your immune system. Right. So you end up losing. And then the meridian is blocked. The organ system tied to it starts to fail. Your immune system is preoccupied with trying to fight all these metabolites and bacteria, and it's losing. And because it's so preoccupied, it's leaving, that cancer cell, it's leaving that autoimmune disease. It's not able to actually function properly. And it's a slow degradation.
So the longer you have that root canal, the worse off you are. So the sooner you can get that taken care of, the sooner you can kind of heal.
The sooner you treat it. But also remember, if your immune system is super strong, you have more time. If you are an ill person and you have already diseases, some kind of debilitating disease, and then you get a poor root canal, that is a very bad combination. So your dentist should at least give you the left and the right side, the biologic situation and the whole body situation. That tooth is not just in your mouth, it's related to everything down to your big toe. It's called the focal infection theory, something that the American Dental Association, something that endodontists fight vehemently. They don't want you to know that your mouth is related to everything else in the body. They do admit that bacteria from your gum disease relates to your heart. Sure. They do tell you that, yes, heart disease is related to gum disease, periodontal disease. That's called the focal infection theory. It works for gum disease and periodontal disease, but not root canals. No, root canals are perfectly fine. Those bacteria stay right on that root only. Right.
Well, and just your story with your back pain and then having that root canal taken care of and removed and fixing that, immediately your back pain went away. I mean, that right there
It's
is a
crazy.
big
I couldn't have believed it myself because I did not relate back pain to a
sure,
tooth. I
sure.
related it, and my neck, by the way, it's also, certain spinal, segments are related to the teeth. My neck
Yeah.
pain got dramatically different. Now, there's things I still need to do. There's metals in my mouth I want to get rid of. There's things that need to be done and that are going to improve even that situation. But removing a root canal that over time got worse, right? Because
Yeah.
we take 3D scans, cone beam scans, and we look at those root canals in all different directions, and we can see a cone beam scan from 2 years ago to this year. There
Mhm.
was growth of the infection in the sinus. You don't feel pain often with these infections. The
Yeah.
mouth is one of those hidden dangers, right? You don't feel throbbing or aching. When
Mhm.
you get a cold or you get sick, that tooth may slightly ache because now it's growing faster, but most of the time you do not feel the pain from a root canal abscess. And abscess will find a way into the mouth. Sometimes you get like a little pus pocket. Sometimes it goes into your sinus and you have sinus congestion. You think it's just a cold or allergies.
Mhm.
There's more to it, for sure.
So if someone came into your practice to get that fixed, to have their root canal removed, what is the process? How
Mhm.
long does that take? Is it a multi-step, and what can someone expect to see?
Absolutely. That's a really good question because this is what I do most these days is if you have decided, you had the conversation, we give you all the options, leave it, retreat, another root canal,
Mhm.
um, take it out and leave it, bridge. When you've decided that you want that root canal out, here's
Mhm.
what we do. Number one, we make sure you are healthy enough to have the procedure done. So we do a vitamin D3 test. And that can
Okay.
be as simple as a finger prick in the office, and it gives us a number. We want that number to be over 60 or
Okay.
70. You
Okay.
can go have a blood test done, which is way more accurate. And
Mhm.
that tells us generally, it's like an indicator. It's like the oil level in your car, right?
Right.
What shape is your car in?
Sure.
If you are at 30 or 40 or even less with vitamin D, you're not going to heal.
Mhm.
You're going to have a very hard time. Your immune system is overworked. In that case, we build up your immune system for 4 to 6 weeks. And we
Okay.
have ways of doing that. We have certain supplements, we have certain IVs. There's ways to improve your immune system to make this procedure more successful and to make you heal better. If you're at
Mhm.
60 or 70, which by the time we've done talking to you and you've seen us for a while, you're going to be above that because you're going to be doing the right things.
Sure.
Then we have a 3D scan, so we know exactly what the tooth looks like.
Okay.
I know what I need to do. It's not a difficult procedure. I've done it a million times probably at this point.
Sure.
There is a 3-day procedure ideally. You need to prepare your body. So, number one, you don't want to be sick. You want to be feeling good that week. If you have a
Mhm.
cold or a runny nose or it's a stressful week at work, not a good day to have a root canal removed.
Yeah.
So you go see you come to our office. We have an IV in the office, but you generally want to get a IV which is filled with vitamin C, glutathione, magnesium, Myers cocktails. Everybody has a different cocktail, so to say, to boost your immune system. Some patients do only the day of surgery, but it's
Mhm.
always recommended to do the day before, the day of, and the day after.
Okay.
The day before and the day after, we work with a local company called Bozeman IV. They do a fantastic job. The day of, it's with us. So you
Okay.
come to the office, you be well prepared, you know what's going to go on. You sit down, you get a very relaxing IV, and the IV is going to boost your immune system. You're going to sit there, we're going to talk about, your day. I'm a non-stress dentist, all right?
Yeah.
I do not want to make this any worse for you. If you're not gonna laugh at my jokes, that's fine, but we're gonna have a good time. Okay. So the
Sure.
IV takes maybe 1 to 2 hours because it has to, drip into your system.
Mhm.
When the IV is done, we draw blood. We
Okay.
use your healing proteins. You probably have heard of PRF or PRP,
Sure.
platelet-rich fiber, platelet-rich plasma. We draw 4 to 6 vials, depending on how many teeth we're going to take out, and we spin out in a centrifuge the most important part of your blood, the healing proteins. the
Mhm.
plasma. And that little part of your blood, of a vial, it's going to be just the little top part. It
Mhm.
looks like a slug. You pull
Yeah.
it out and you cut it off. You cut off the red part, you keep the sluggy yellow part. That is the optimal healing plug for the socket. We put those aside, okay? Then we make sure you're numb. We numb you up, make sure you're comfortable. You have to take the tooth out in as atraumatic as possible. We don't put our hand on your chest and pull. That is not how
There's a
dentistry
way.
works anymore.
Yeah.
It is a surgical procedure. You really gently trim the tooth in a couple pieces. You take it out without damaging the bone around it. You don't mutilate the tissue. It's an art, and it's a lot of fun to be as atraumatic as possible.
Mm.
Now, when that tooth comes out, you have a socket.
Mhm.
That socket is surrounded with bad bone, a periodontal ligament, the ligament that used to hold the tooth, that is infected, and possibly some really nice cysts and things like that. We love to find those. We take them out, we show them to you, we take pictures of them, they're great.
Yep.
You have to meticulously take all that out. So we're going to be cleaning and cleaning and cleaning. We're going to scrape out that socket. There's no nerves in the bone, so you don't feel any of this anyway. We scrape, 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 and until we get all the periodontal ligament and all the infection, all the granulation tissue out. We rinse the socket continuously with ozone water. Ozone is the best disinfectant we have. It kills all the viruses, the bacteria, the funguses, and your body can totally handle it. Your body has the enzyme to break down the ozone. Nobody else does. So we rinse, rinse, rinse until we know that socket is clean. Sometimes we use a laser. There's all kinds of lasers we can do to debride it as well. But now we have a very clean socket. So the next thing is we want to see healthy blood flow. If you don't have healthy blood flow, you cannot heal. So if we're injecting you consistently with epinephrine, because a lot of the anesthetics we use are loaded with epinephrine, epinephrine stops blood flow. That's why we use it. So the anesthetic stays in the same spot. We have to then use non-epinephrine or very little anesthetic so that you can have good blood flow, because blood creates the healing clot, right? We take those little slugs, the PRP plugs, and we put those into the socket, making sure there was good blood flow ahead of time, and we pack it to the top, make sure it's nice and flush, and then it's real important to create a beautiful artistic suture on top. I love suturing. To me, the suture and keeping everything in place is very important. Now you have a clean socket. It's filled with your personal healing proteins. We've sutured up really nicely, and then we go ahead and have you bite on a gauze soaked in ozone water, and that takes care of that. So that is for just removing a tooth. Very frequently, we will immediately also be placing a ceramic implant.
Sure.
Because if that is an option, that is the best time to place a ceramic implant, because it acts like a tent post. It holds the socket walls apart, gives the bone a place to grow towards, and it saves you a tremendous amount of time of healing, because implants take 4 to 6 months to heal. The socket takes 4 to 6 months to heal. If we skip half a year, that's a really good amount of time to save. It's not always the option, but if we can do it, that is the best option.
Okay.
And then you go home, and then the next day you get another IV. I personally am very big about the biome, so I'm going to give you a probiotic to take, Osbiotics. I created it for this purpose, and a probiotic diet, a 5-day that you do twice. So it's a 2-week eating plan that maximizes the healing for you. That's the challenge I had when I had my tooth taken out last year, September. The biggest problem was, I've done this to patients thousands of times, and now I'm going in there. I'm having my tooth removed, and I leave the office. I feel a little loopy, but I feel good. I'm like, what do I eat? I can't touch this whole side. I'm in a foreign city. I can't go to a restaurant. I am very picky about biological foods, organic, gluten-free, whatever. And it was a nightmare. What do I eat for 7 days or 2 weeks? So I made this 2-week diet so patients know what they can eat. It's a protein rotation diet. We can get into that if you want, but It's designed to maximize healing and digestion, and also give you one perfect fast per week, an empty digestive system. So
Sure.
Monday's red meat, Tuesday, Wednesday's white, Thursday's gonna be fish, Friday's vegetarian, Friday night perfect fast. So we do that 2 times in a row.
Yep.
And often we do have to give you some antibiotics. I'm not a huge fan of antibiotics, but
Sure.
you heal better with amoxicillin, penicillin, or maybe something mild like a Z-Pack. That's all I would give. A lot of patients expect it. Meaning, if you tell me, oh yeah, I have a knee replacement, I need antibiotics for every procedure. I'm like, no, you don't.
Yeah.
This has been disproven. It's not good for you in any way. Sure. They will get sick because you're going to not do what they expect, and it's a very psychological thing. Yeah. They will get ill, and it's going to be your fault because you did not give antibiotics. So I'm like, you're right. Yep. You definitely gonna need the antibiotics. So here, take your probiotics, take your diet till you rebuild your biome after we completely obliterate it. But same thing for when we take out a tooth. Sometimes we put we put the antibiotics in the IV, which is ideal because it doesn't affect your gut. Yeah. But you're gonna want to be taking 5 days afterwards, possibly. And if you do that, you're gonna want to rebuild with a proper probiotic. So that's like the summary. And then we see you 2 weeks later to take the sutures out, and you're golden.
Okay. So you would, I'm trying to figure it out because I'm like, okay, maybe I go up there and do this. I have 2. You were saying if someone was healthy enough and their levels were good enough, you would actually do 2.
Oh yeah, we do. Time? 2, 4, 6. Okay. We do as much as possible in one visit because you're going to heal the same for 1 as you would for 3. Sure. And you don't want to do it more than once if you can, right?
Right. Do it one time. Okay. What about metals? You were talking about getting some metals out. So of course mercury was the go-to. I have some gold teeth and just some gold kind of crowns. Yeah. Good, bad.
Yeah. Excellent question. Metal. So I'm getting my metals out as well. Here's the deal with that. The body is not made to have metal inside. Mm-hmm. It's just a foreign material. And with the environment we live in, the EMF, all that stuff, you attract, almost like an antenna, the frequencies that you're surrounded by. That's a whole different subject. I'm a big EMF guy for many reasons. But it's not the 1980s or 70s anymore. There is so much change in this environment that metals, I've seen so many metal allergies in patients that I never saw 30 years ago. I see them all the time, and it's because of the environment, right? So metals are allergenic, and people's immune systems are tremendously stressed. A stressed immune system is not going to want to have metals in the mouth. Yes, a high noble gold, a yellow gold, is usually much less allergenic than mercury, which is the most toxic non-radioactive material in the world that we still place in patients' mouth. Now, I've never placed one since I went to dental school because it's stupid, but people do. And so there's a myriad of differences. You do not want mercury fillings for so many reasons, banned by the EU as well as of January 1st. There's so many studies on mercury toxicity. America, fine, put the mercury in.
In everything.
It's ridiculous. You can put it in the patient's mouth, but you cannot put it in the sink, in the water supply. It goes either, I always tell my patients, there's 2 ways this mercury filling leaves this office: in your mouth or in this hazardous material bag that I have to spend extra money for just for mercury. Not even the other stuff. It's a mercury hazardous material bag. So it's okay for you. It's really insanity is what it is. Yeah. Besides that, mercury expands and contracts and always cracks teeth. So it's wonderful for dentists. We love it. Great for business.
Permanent patient.
Terrible for you. So mercury, absolutely 100% an issue. You want to get rid of that. And then it goes down the scale, right? Titanium implants, not a fan. Tremendous amount of chronic inflammation around those. The studies are very clear. 20 to 50% chronic inflammation. Chronic inflammation, root cause of all disease. You're never
Right.
getting rid of it. It's stuck in your bone.
Yeah.
It's leaky gut right there in your mouth.
Yeah,
You
for
know,
sure.
it's an entry portal past your security system. It's no good, right?
Right.
The same thing goes with gold. Most golds are base metal or semi-precious metals. There is silver, sometimes nickel in it. There's all kinds of terrible things in there. When you look in somebody's mouth and you see the gold edge that touches the tissue very, very frequently, especially now after something that happened 3 years ago and destroyed people's immune system, purple margins, purple
Mm-hmm.
tissue. Purple is the reaction to something toxic.
Mm-hmm.
It's all over people's mouths. And
Mm-hmm.
it's more frequent around the white metals or the base metals, but you also are now seeing it around gold.
Mm-hmm.
So yeah, prioritize your treatment. You're not going to
Sure.
die immediately if you don't
Sure.
take everything out and you get all your root canals done. I mean, this is people get overwhelmed, and you do not help them when you overwhelm them. You got to
Sure.
tell them there's a plan
1
to
time.
get healthy, and you have time.
Yeah.
If you stress about it, everything goes to pot. Stress is worse than anything that's going on in your mouth. Trust me.
Right. Yeah. Yeah.
So yeah,
That's so
metals
awesome.
is at
Yeah.
the end of the list, but yeah, definitely on the list.
Okay. I know you always go, okay, what's the safest thing next? And everything
Mhm.
changes in medicine. So what we used to do, we don't do, but there are still, you're right. I mean, there's still kids will smile. I'm like, oh my gosh, they've got a mouth full of heavy metals in there and they're kids.
The kids get the base metal crowns. I don't understand why. When I worked on kids, I don't do as much anymore, but
Sure.
when I worked on kids and they needed a crown or a stainless steel crown, as they call it, which is insane. Okay. It fits worse than a hat on a hat rack,
Sure.
gives bacteria an incredible place to hide. It's just the worst thing you can do to a child, but it's easy and it's quick. It's what they teach you for pediatric dentistry. I did real temporaries for those kids made out of a strong composite resin that is filled with zirconia, not plastic. I tried to minimize, I mean, kids to me are sacred. You
Sure.
got to stop messing with the kids. They don't
Yeah.
need all these, they don't need
Right.
to be
Poison.
all these fillings and fluorides and stainless steel crowns. You got to leave them alone. We're supposed to protect the kids. We're supposed to be their guardians. And it makes me so mad that I think a lot of people see them as a lifelong client. And that's
Right.
when I kind of lose it. I think that is the most criminal thing you can do.
Absolutely. Absolutely. I know it's insanity. I
Mm.
agree. I agree. So if someone wants to make an appointment, do you get people traveling from out of state, other
Oh,
areas
yeah.
to your practice? So usually if you 2 weeks, you need to get the sutures removed. So they need to plan on kind of a 2 week time slot that they can come in, they need to know optimally what their vitamin D level is before they go in, because then it's going to take time for that vitamin D to go up.
We have a
So
plan. We do this
yeah,
all the time. I mean,
sure.
most people see me drive at least 2 to 4 hours. I
Okay.
mean, I'm in Bozeman, Montana by choice now, and it's a
Yeah.
small town, but people drive from everywhere. They fly in from England, from California, from Georgia. I mean, we people come from all over the world. It's standard because everybody finds somebody they trust. Even if
Sure.
they tell them, hey, I have a really good friend in Germany, you can see them.
Yeah.
You don't need to see me. They still want to see me. I was like, you can go to, Salt Lake City. No, when they trust you and you're a good dentist, then that is the relationship is critical.
Absolutely.
We don't waste your time. I mean, I'm going to make sure that when you come here, we maximize your time. You're going to get your vitamin D3 level done, probably at home.
Yeah.
You're not going to show up and then it's going to be, oh, I'm sorry. No, you need another month. That's a
Yeah.
waste of time.
Yeah.
We're going to do a very thorough exam. We're going to look at everything that's going on. That is the most important aspect. That's a visit. That is the most important visit. If you can get me the information from a good dentist, and I can probably refer you to somebody in your area,
Mhm.
3D scan, all that good stuff, then often I don't need to be your dentist. I'm going to be your surgeon for the root canals or the surgeon for the ceramic implants. And then it's a visit. You plan to stay maybe 3 days, 4 days for the first visit. You come in, IV, check everything, verify. Then the next day we do the surgery. The next day We get another IV. If there's any complications, you're still here. Then if everything's golden, you go home.
Okay.
You do not necessarily need to come back for the suture removal.
Sure.
Most patients do that on their own unless they have a problem.
Okay.
So if there's something that goes on, they have aches or pains, which is usually not very common, honestly,
Sure.
then they can come back and we can look at it. But no, it's usually just one visit for maybe 3 to 4 days to make sure we agree with everything in person, do the procedure, and you stay afterwards just to make sure everything's good. You go home.
Yeah.
That's all it takes. And then you heal.
It's awesome. Yeah. Okay. I'm gonna plan mine. I'll kind of walk through the steps and show people. But I remember watching your video. I guess it was September. I'm like, I gotta do that. I have to do
Yeah,
that.
it's
I
fun.
know
You should
that.
document it. You're better
I
at it.
will. I will. I absolutely will. Yeah. It is. It doesn't make any sense. And you're right. It's the only medical profession that leaves dead tissue in the body.
Mhm.
That's never good. It's never good. So
Well, root canal. I tell patients, the abscess on a root canal is comparable to a gangrene toe.
yeah,
If you
wow.
saw a gangrene toe, and you should Google that. I mean, that's pretty ugly. A
Oh
gangrene
yeah. Oh,
toe,
I've seen them. Yeah,
it's gonna get cut off.
that's
It's
right.
stinky. It is nasty. Okay, but you would not walk around with that gangrene toe for very long.
Sure.
People walk around with gangrene toes in their mouth all the time for years. And
Yeah.
they wonder why their immune system starts to fail. And then their immune system starts to fail. And guess what? Oh, it's Hashimoto's. I got to go get all this Hashimoto's treatment. Oh, no, it's all kinds of other autoimmune diseases. It's diabetes, it's heart disease, it's brain fog. We need to stop compartmentalizing this and
Sure.
this. It's not
Yeah.
medical insurance, dental insurance, it's the body. It's
Yeah.
all related.
Yeah.
As my good friend Dominic says, health starts in your mouth, and it really does. If we
Absolutely.
don't take out the parts of your body that cannot heal, you're not going to heal, and you're going to be in the system forever. And
Right.
that's what they want.
That's what they want. Yeah.
Mhm.
So how far booked out are you? Are you
2 3 months or so is
okay?
is the average now, and it's growing because we're small and it's getting worse. We're probably going to build a new facility by the end of the next year to expand and grow a little bit, so there's more options.
Sure.
Maybe I'll train a dentist or so because there's
Sure.
literally only a handful of us in the United States that I trust.
Right.
And they're all are booked out. There's no really good acute emergency biologic dentist anymore, which is a problem, right? I mean,
Right.
if you have pain and you don't want a root canal, you want that tooth removed properly,
Mhm.
you're going to have to see a biologic dentist. And it's
Yeah.
very hard to call me up and say, "Oh, I'm dying today. It's awful. Can you pull out this tooth biologically?" I'm like, "Well, let me call Bozeman IV and see if we can get the IV started.
Sure.
How's your vitamin D3 level?" And you can't do that. So in real
No.
life, you just do your best.
Yeah.
And then we often take out the tooth. We
Mhm.
sometimes don't get you to do the IV because it's just an emergency. We clean
Sure.
it out good. We draw blood because we can do the PRF anytime.
Sure.
We draw
Absolutely.
blood, we clean it out, we pack it. We do the best we can. We can't wait for you to get healthier if your immune system's poor. But
Yeah.
it's you know even biologic dentistry is not always ideal. We can't always do things the way we want. We have to realize that our patients have real lives. They have
Mhm.
real financial constraints. They have
Sure.
real time constraints.
Yeah.
And I, for one, work around your schedule. I believe that for me to overwhelm you with everything that's going on is doing you no good. So my main goal is to serve you the best way I can, to treat you, to get you healthier in baby steps. And
Yeah.
every time you see a biologic dentist, you should be a little bit better, and you shouldn't feel like you just mortgaged your house to try to fix your whole mouth all in one day.
Sure.
That's unrealistic, I think.
Right. Right. But your health is everything. And
It
so
is
without
everything, but
that,
potato soup every day because you're broke doesn't help either, right?
sure. Yeah.
We can
Yeah.
we can do it in stages. And yes, biologic dentistry is absolutely important, but
Mm.
it's not everything.
Mhm.
there's other things we talk about. Like if your biome is screwed up, I'm not going to be able to help you very long. You're going to get decay, you're going to get gum disease, you're going to get leaky gut. And what I do is a very small portion of the overall package. It's functional medicine, starting
Right,
with the mouth.
right, right. Okay, I'll book my appointment. I love
Cool.
it.
I'm excited to help you out, and we should document it and
I
make
will.
it a fun adventure for you.
Absolutely, absolutely. That's so awesome. I know I have more stuff, but I know it's late for you. So if you're willing to do this again down the line, I'd love to pick your brain a little bit more. I have people reaching out all the time. What about this? And it's all in your field.
Hmm.
I'm like, hold tight. Let me ask those questions because I don't know
I
those
love
answers.
talking.
Yeah,
No,
I love it.
this is my passion. I love answering questions, helping patients. I used to do a ton of Instagram lives. If you ever want to do that, that's really good. People can ask questions right there. Um,
Sure.
yeah, any way I can help people make the best decision for them,
Yeah.
I'm game.
I love it. I love it. Well, thank you so much. And I'll be in touch. I'll be calling. What's the phone number to your office? And then we'll post it as
Mhm.
well. So people can get a hold of you and set up an appointment if that's something that they need
Oh,
to
for
do.
sure. I have no idea, but it's
Okay,
saddlepeakdental.com is the
okay,
office. But
sure.
you can just Instagram is really where we all come to contact together, and it's Dr. Chris Hahn is my Instagram handle.
Yep.
As you know, that's where I connect with most of my patients around the world,
Okay.
and that's where we start. And if you want to learn more about me, bossoralhealth.com is my company, and there's a lot to learn about that as well. But DM me on Instagram or go to our website and send us an email or call us, and we'll be able to help you out for sure.
Perfect. And let me know when your toothpaste comes out because I'll be purchasing that too. I'm serious. There's
Absolutely.
there's so many options. I've got 4 kids, and so you really just this is the time to really make sure that their mouths are in the tip-top shape. Of course, they eat a lot of junk food and stuff, so you
Hmm.
do your best, but, there's so many
Yeah,
options to pick, so you let me know when that comes out. I'm sure
I can't make it. I can't find a paste that I'm happy with because
okay.
every paste is full of glycerin, full of
Yeah.
water, silica. They
Mhm.
have to have a base. I
Yeah.
made a toothpaste a long time ago. It was an effervescent tablet, a little tiny pearl, and
Okay.
it had none of that junk in it. And you just put it inside your toothbrush and you put water on it, foam up, and you'd be good to go.
Yeah.
So maybe something like that. I don't like tooth powder because you have to dip it in that jar and it's
Sure.
messy.
Yeah.
So there's very few great solutions for kids, like for your kids.
Yeah.
The strawberry flavored super teeth works
Mhm.
because the kids actually use it and it's not that harmful, and a tiny bit is all they need. I mean, they need almost none. It's just
Sure.
to get them a positive experience when they brush their teeth. That's all
Sure.
it is.
Sure.
So
Sure.
don't think the toothpaste does anything positive to them. Take a probiotic afterwards, a postbiotic. That is what's going to do all the stuff that you think your toothpaste does. It's not the toothpaste.
Okay. Okay, and we'll attach that to this too, so people can go on and get that as well, so
Awesome.
awesome.
Thank you, sir.
Yeah, thank you so much for your time. I appreciate it, and we'll be in touch.
All right. You have a wonderful night. Thank you for having me on. I appreciate you and I love your
Absolutely.
content.